I believe that we need to keep on moving towards better practices in order to be respected as professionals, and history might help us to improve the current standards. We must note that fines existed under this legal system and that the fines for infringing this particular law are substantial, especially in comparison to others. Repeated offenses are treated severely, and that a three-strike rule is in place. I think that in order to be respected by society, we need to demonstrate that we are serious about our job, that we have consequences if we are not acting in a professional manner. This might be reinforced the profession by requiring continued professional development, a true commitment. This leads to the next question. Do we need to adopt fines in order to enforce the standards? This is a topic for another time. I would invite you, my interpreting and translating colleagues, to consider it as we continue discussing the standards and practices of our profession. Thank you very much.
But in the last few decades, some other folks came along that said, hey, let's look at translation another way. It's not an impersonal activity, it can be a social activity, and most of the time it is. And then other researchers added, translation can be a form of activism, and translators don't always just do as they're told. They don't always agree with the views of the powerful. Behind these blogs are some overarching goals. Hemos oído, which means we have heard, I don't know if I mentioned that. They say their goal is to spread the words of the Cuban bloggers beyond the fortunate 350 million people in the world who can read them in Spanish. And Translating Cuba, the other colorful blog, says that they want to mirror the free, open, and plural society that we know Cuba is ultimately destined to be. So they're a little bit more forthcoming about what they want. For the translators, this is for the English only pages. The other ones weren't as organized, so I wasn't able to tell, but 1,776 translators. And if you look through, there are a lot of them, like this guy goes by T, and this guy goes by Wilfredo. So many people translate anonymously because they're afraid of, I don't know why, they're probably afraid of political To close, the World Wide Web has added a sense of immediacy to the work of translators, which I find very exciting. And the work on Cuban blogs is only one example of how translators are becoming active in issues through the translation of text. Thank you.
In reality, it is one skill to be bilingual and an additional skill to be an interpreter. In fact, to be an effective interpreter, one needs to have learned well the different modes of interpreting, the role of the interpreter, and the standards of practice and codes of ethics, the different areas of interpreting, along with many other skills that separate the interpreter from the mere bilingual speaker. Like with any profession, all interpreters must adhere to a certain standards of practice as well as codes of ethics. Each type of interpreting has its own standards and codes, but they are all very similar to another. The ones shown here are from the National Council of Interpreting in Healthcare. So I think it is quite clear by now that although being bilingual is a prerequisite to becoming an interpreter, it is only one piece of what is required to be an effective professional interpreter. The skills necessary can be learned in courses, but must be practiced and refined before one can be considered a professional interpreter. It is hard work and requires making and learning from many mistakes. In the end, it comes down to a passion for languages to motivate the interpreter to always strive to become better. Thank you.
As you've heard today in our presentations, what guides us in our role and trying to understand what our role is as medical interpreters are the code of ethics and the standards of practice that our other colleagues here have referred to. And while those can guide us, and we are well versed in them because We cover them and we discuss them constantly, not only in our coursework, but on the job. For example, there's many other aspects to our job that could make it difficult for the interpreter to be accurate, and that is one of the key values or principles in interpreting is that accuracy. And as you mentioned, I think, especially in the medical field where it can be life and death, or somebody could be, or treatment could be affected. So I'm a big advocate for doing a lot of work around helping the larger community, and especially within the hospital, to get our providers to understand some of these basic things as pausing or not using abbreviations and using simple language. And then the last piece, so that I can get Adriana up here, is a lot more training on cultural competency.
One of the important aspects of interpreting is the professionalization of the interpreting, and we actually advocate for it. Right now, I think interpreting it is in a transition phase. We are moving away from that common misconception that interpreting is an effortless activity that can be done by any bilingual, to the understanding that interpreting is a very complex activity that requires training and the development of specific skills. So we are moving, and it's a slow transition, and I think it is very slow because this misconception has been embedded in the society for years and years and years. And there is formal training available. We have the TRIN programs here at Century College at the University of Minnesota. There is another 40-hour training program that is more like oriented to those interpreters that have been working for many, many years, so they can get some formal training. We are asked all the time to step out of our role, but they really don't know what our role is. So it is difficult, and I think we are going in the right direction. I think the next steps we need to take to really be considered professionals is to first make training, formal training, a requirement to work as an interpreter. The other thing to get the education, the provider's education should be done not as interpreters just one by one, if not at a organization level. And but I think there is light at the end of the tunnel. I think it's going to be important that a big important piece of this will be that the interpreters actually work together to be able to accomplish this. So.